Hi, friends. Happy Saturday again, although it's Saturday evening. Yes, I know. Once I start talking, I can't just say one. I start thinking of other things that I think you should know. You know, really look, those of us in this for years, you're looking for answers. And I know some of you are newer. A lot of you on the Twitterverse here, as NIH calls it. We saw that in the FOIA documents. Anyway, you're looking for answers, all right? And I notice, I'll tell you, there's a new money train going on. People, all of a sudden, people that are, following the money, they all got long COVID. They all got long COVID. No. No. Okay, I'll be first one to tell you. No. No. They don't have long COVID. All right. When you have ME, okay, any infection is gonna flare it and put you in a relapse, like which is no cherry to the original. It's actually, it's like you never knew. It's like, uh-oh, you're starting again. You're starting again. We've all been there. You know, when COVID was starting, I thought I need to get prepared. All right, because I had COVID. All right, but I'll give you an example. In 2013, I had this bronchitis. I must have been in that immunologist office 4 times that month. It took about 5 weeks, right? And I had to have a nebulizer machine. My peak flow, if you know anything about the peak flow, if you had asthma, have asthma, my peak flow was only 200. It should be over 400. It was only 200. I was using that nebulizer machine every 2 hours. It was a nightmare. I was in and out of that immunologist office 4 times. I was on steroids the whole month, 2 Z-Packs, the albuterol, and he also, there was another nebulizer like a steroid. It was just terrible. And in the 5th week, the peak flow was 400 again. But it wasn't over. I had a relapse from hell. It took 2 years. And it was then, I had 2 long-time doctors. My longest long time in Altamont Springs, which I drove an hour and a half for 22 years. We started one of the antivirals. The one closer, when the one that the Altamont Springs doctor prescribed, the one over here, closer, he prescribed the other one, a cyclovir, Valtrex, valacyclovir. And then it was over a year. And then I finally, Valcyte became generic, valganciclovir. So I did a little research, and I thought, oh, okay, the insurance is going to pay for it. So I told the doctor, I says, Valcyte is generic now. The insurance will pay for it. So that was the big guns. And it took about 3 months for that to totally work. All right, and I was still taking the valacyclovir. I had one doctor prescribing one and another. I used to be a nurse, and I'll tell you, I helped my friends work the system, and I have worked the system all through the years because these things happen. It is hard for patients to get care, and there was no way I was going to a hospital here. They would have killed me, really. It was similar to like what was going on with this COVID. People give in and go on the ventilator. There was no way I was going on a ventilator. I was using that nebulizer machine every 2 hours. I would imagine if I went to the ER, they would have brought that up to me. I mean, that's how bad it was. But it took 2 years for and multiple antivirals to bring the viral titers down. And the thing is, a lot of us have thyroid disease, and my low thyroid, we were still adjusting the dose. It was many years before that was diagnosed, and that was still going on. When you have other autoimmune things going on top of it, it makes the disease worse. It makes it spiral out of Terrible. All right, so what happened here? Their ME relapsed. That's what happened. All right, now they're calling it long COVID. You know, uh, through the years, I had a number of relapses like that. So when my time for COVID came, earlier to 2020, I was hearing of the early treatments. I got my connections. I have connections. I learned to have connections. Actually, my father taught me about connections when I was a kid. Always have somebody. And I had early treatment. I also get IVs at home. So when August 2020, when the fever started, I knew. And I got in touch with my connection, which is a doctor in another state. I got the early treatment. I had the IVs going. My wonderful IV nurse, she came anyway, all masked up and everything. She says, well, I know you need the IVs. And I had a whole fresh supply of antivirals. Anytime something happens, I keep the antivirals on board. Don't be a sitting duck with this illness. Do not be a sitting duck with this illness. Protect yourself. And, nobody else is going to do it for you. You have to take care of yourself. You have to stay proactive. All right. And that's why you have a lot of us here, You message me, I'll give you suggestions as a fellow patient, not as a nurse. I haven't been active in the nursing profession in over 20 years, but I can do it as a patient, give you suggestions. You must be prepared. Okay, so that's what's going on. They're saying they're having long COVID because it's a new money train. All right, there's about 7 orgs jumping on the bandwagon. And you know what? That's a way of misinforming. Just tell them what the hell the illness really is. I'm really tired of seeing patients misinformed. I have the ability, I've always had the ability as a patient to look out from the outside in at my friends who are suffering terribly, terribly. And just I shake my head how this is still going on. And you see it. History is repeating itself with this COVID. I worked frontline aides. The same thing happened then. Meds were held back. People died that didn't have to die. All right. Anyway, remember, secrets of the ME patient. We will keep you informed. God bless, friends.